All right, Steph, I know we talked a little bit before, but still, can you like introduce yourself for the audience?
Hi, yes. My name is Stephanie McCusker. I am a strength and conditioning coach originally. I got my degree in kinesiology at University of Maine, and I moved to Los Angeles right after university. So I expanded my experience working with clients by being introduced by or to holistic lifestyle coaching, first through Paul Chek, which was interesting. And then I had the ultimate luck with meeting Guy Voyeur and starting his training program back in 2008. So I've been studying under him until last year when he passed away. I guess it was a year and a half ago. But I continue to practice all that I've learned from him and try to stay true to his teachings of especially ELDOA, but the SOMA training program.
Cool. So, obviously, I don't know a whole lot about ELDOA or SOMA training, but I realized like some of my mentor, like guys like Dan Pfaff, guys like Adam, they use a lot of ELDOA. So, can you kind of like um share a little bit about like what exactly is ELDOA?
So ELDOA was developed by, like I said, osteopath Guy Voyer. His background was not just osteopathy, but he studied and became a medical doctor as well as a PhD in education. Because he's from Marseille, France, most of his teachings were in French, and so when he developed the ELDOA, it's actually a French acronym. The acronym itself, if you translate to English, is longitudinal osteoarticular decoaptation. And so, what that big mouthful really means is that he was really quite motivated to help people, especially with back pain. Back pain is, as you know, one of the biggest ailments that people have. About 90% of the population will have back pain at some point in their life. And so in his research, he was looking for, if you would like to say, a magic bullet, but a way to be able to help people actually have lasting back pain relief. And with this development of his exercise, he took information from many different methods that were available in those days, talking about especially the fascial chains and how the fascia has a big relationship to the health of the spine and movement. So, ELDOA itself is a specific organization in a posture that will help to utilize the connections of myofascial chains in relationship to the joints, where you're able to fix one part of the joint and be able to open or decoaptate, pull apart the joint space using myofascial tension. So the beauty of it is that it's self-normalization. It means that the person is able to do it themselves. And the advantage of that is you have a much bigger stimulus on all of the supporting structures around the joint. So often with passive treatment, things like chiropractic treatment and osteopathic treatment, you can have a very good result with being able to help with a lesion, to help to put the vertebra into a good place, for instance. However, the missing piece often is something for the client or the patient to be able to do on their own, to be able to maintain that adjustment or that correction. So his goal was to create a very effective exercise to give to his patients so that he wouldn't have to see them every 2 weeks or have to keep doing treatments on them. And he found it wasn't just helpful for the lesion, for instance, if somebody had a bulging disc at L4, L5, for instance, that obviously creates a lot of compensation patterns. You have effects on not just the pain tolerance, but the compensations coming from posture that can come along with injuries. And so the ELDOA works at a much deeper level with the proprioception, the awareness, the nutrition of the disc. And so as an actual exercise, it becomes like a therapy that a client can actually do for themselves and be able to more effectively correct an issue as opposed to just trying to treat the symptoms of an injury, for instance.
Nice, nice. So, uh, why is uh spine health have like high correlation with the fascia?
Yes, so in reality, the connective tissue or fascia is the body's second brain, if you want to think of it that way. So obviously the container for all of that is within the body. You have several layers of fascia throughout, deeper fascia, superficial fascia, and then you have the unorganized fascia as well. And because of the integration of all that fascia is within the body, the spine, you could say, arguably, is your motor to your body, to your movement. It's the ability for your body to be upright in gravity. However, if you understand how Tensegrity Model works in the organization of how the body moves, you have discontinuous compression with continuous tension. And so really the bones are just floating in the space that is within the connective tissue. For the spine, or to be honest, with anything in the body, if there is an injury to the fascia, you are going to see an effect on the ability for the body to function. And so really, in treating anybody, not even just in rehabilitation, but prehabilitation and recovery, if you're not taking into account the quality of the fascia that is involved with the injury or with the goal, then you're missing a really big element to be able to help somebody improve.
Hmm. So does that mean like so does that mean outdoor is what's so-called fascia stretching?
You could, yeah, it's a good question, actually. There is a little bit of confusion sometimes when we talk about the fascia and stretching fascia. In reality, you don't want to stretch fascia. You don't want to stretch the connective tissue. What you want to be able to do is stretch the muscle that is within the connective tissue in relationship to the connective tissue. When you talk about if you're wanting to improve joint range of motion, for instance. So, in the example of what most people think of for flexibility, the flexibility of the hamstrings. So we have technically the hamstrings are not a muscle. You have three separate hamstrings, and they all have a big individual line. So talking about fascial chains. For each of those three hamstrings, you have different fiber orientations. And something that you can run into when you're trying to stretch, for instance, or increase range of motion, is that if you target the muscle itself, say, for instance, you want to stretch the biceps femoris, which is a very important one, especially after somebody's injured or had an ankle sprain. You have to be sure that you first, one, have a muscle to stretch, right? So if you have somebody who has very flaccid muscle, not a lot of muscle tonicity, and they complain about being very tight all the time. If you try to just stretch the muscle, or sorry, stretch the muscle itself, quite often you can create a bit of inflammation because the muscle fibers themselves aren't present. So one of the big rules with working with fascia is that it's myofascial. You have to take into consider the whole system, the myofascial. For the biceps femoris, the angle has to be the correct angle in order to work with the biceps femoris particularly. So the fiber orientation is very important so that you don't create micro tears in trying to stretch. And the other part, like I said, is actually having the muscle there. So often you'll find, even in muscle testing, that people have a very weak, tight muscle, and that's the worst for the function of a joint or of a movement. So often with working with the myofascia is that you want to make sure first there is good muscle that is present. So working the specific position for the biceps femoris, for instance, You can work in internal range or external range, total range. And to build muscle, you first build the muscle, activate, and then from there you can begin to create a myofascial stretch that will then help with the proprioceptive awareness. The muscle spindles will start to be more aware of range of motion, what is possible for the joint range. Long-winded really is that the more general that you do stretching, the less results you will get with the function. So the more specific that you can possibly be, so in doing myofascial stretching, you end up with a very good quality connective tissue, not just a dumb piece of meat that is the muscle. The actual integrity of the performance of tissue is dictated by the fascia, the myofascial connection. ELDOA itself is an exercise specifically for the joint. So Guy has developed many different modalities and method or exercises. ELDOA is only targeting the joint space. So the joint between L5S1, the joint between the glenohumeral joint, the coxofemoral joint, for instance. The goal is to decoaptate and to open the space and all that is in relationship to that joint. Not only just the ligaments, but also working with the muscle, connective tissue, tendons. Myofascial stretching is in relationship to the particular chain that is in relationship to the muscle that is targeted. So you can appreciate it's not a very, it's a very subtle difference if you're unfamiliar with what the goal is of the exercise. But in practice, there's a very big indicator as to how you're holding the posture to create your tension and what your intention is for that particular stretch. ELDOA itself, you are stretching. However, you are in practice because you are trying to open up a joint space. The goal is to open it evenly. You don't want to bend to one side, bend to the other. The goal is not to create an opening on one side. It is to open all. And in doing that, it is considered a stretch, but then the requirement is to hold it there. And this is where really for the effect of the proprioception and the connective tissue comes into play. When you want to target the spine and be able to open up a joint space for L4, L5, I use my example. L4, L5 is very important because quite honestly, it's one of the most herniated discs that people experience. And it's often because the joint space begins to close with the amount of pressure or compression that comes from aging and from the biomechanics of the spine. For an ELDOA, when you solicit this decoaptation, you create a big stimulus for all of the tissue around it, like rebar. So for instance, if you did a traction table and you hang upside down, you get the same result as far as opening up the space. That's very helpful for decompressing a nerve. So if you have nerve impingement, then it's very helpful to depress the nerve. Problem is that as soon as you come upright again, you get that compression from gravity right back onto the joint space. So there's no change in the tissue tonicity or the ability for the tissue to manage the space. When you do an ELDOA, you use your own muscle strength to create a stretch in the tissue. You stretch the tissue as much as you possibly can in an extreme range, we say, and then you hold it there for 60 seconds is really all it is. The reason 60 seconds is the magic number is because the muscle fiber types that you're trying to tap into. If you take the example of doing a 400-meter dash, right, it's very difficult to hold that kind of intensity for a long period of time. So 60 seconds is where you have a good result and you have the endurance that's needed for the tissue to be strong, not just long. So you're strengthening at the same time as stretching when you perform an ELDOA.
Nice, nice. That's perfect. That's perfect. So, uh, forgive my innocence because I'm just starting to learn uh, this outdoor stuff. So, is 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 it technically like Soma training is the whole system, then outdoor just one of the exercise or one of the thing you guys work on?
Yeah, exactly. Yes, the summer training program that Guy developed is really a 4-year program that includes many different modalities. The first of which, like I talked about with having the myofascial stretching, the first is strength training. You must first have a muscle to be able to ask it to stretch, or else you are stretching fascia, which means that you are actually creating an inflammation. So the first level is segmental strengthening. The segmental strengthening I found as an athlete myself. I had lots of injuries as a jumper at university. It's a lot of impact, a lot of compression. I had many injuries for ankles and knees and hips. And with the segmental strengthening is that you're able to target the muscle within the chain, and you're able to strengthen any weak link that might be present there. Once you have a minimal amount of strength in a certain muscle, then you can ask it to be able to work nicely with the other muscles within the group and within the system. So the goal is not to just isolate. You isolate and then integrate, which is very common. But what I loved the most about Guy's training was that you could get so specific that you could find really in testing somebody, they might be very strong in their middle range of the glute medius. But as soon as you put them into the anterior fibers, for instance, they have almost no strength. And so you see a strength discrepancy in the ability for them to control their joint. And that's where you start to see a big breakdown. So you need to be able to have that isolation, and then working with the squat, for instance, or a global postural movement, you're able to then integrate into a good working system. So with the strength, then you learn the ELDOA. The ELDOA is for the joints, the health of the joints. Myofascial stretching is for the length tension across the joints. And then you have things like proprioception, which is to educate the ligaments in relationships to the joints. So in total, the SOMA training program gives you all these tools to not just hammer. If you have, I don't say ELDOA is the best in the world. It's a system. You're able to actually be able to help the body, especially the fascial system, through intelligent training. So the SOMA training program I found absolutely the best as far as your level of anatomy and the applying it physically to a person, not just having the knowledge of what, there's actually whatever 6 muscles in the quadriceps group. To know that and to have that information is one thing, but to be able to actually have exercises designed specifically to apply that knowledge, I found absolutely groundbreaking for me, because it's you could utilize it immediately with clients and with athletes and see really impressive results in their ability to move and function.
Mm. Can I understand like Eldor this way? It's kind of like joint mobilization, but more in a more functional sense. And then because instead of like we're increasing like we're distracting the spine or the joint, it's they're doing it by themselves and with muscle contracting on both side or both end. So the when it stand up, like the proprioceptors already like telling your body, telling your brain to like decompress that area.
Mm.
Am I making sense or I don't know?
So the application of the ELDOA is beneficial for all. If you think of really in life, your development of your spine usually finishes developing around 20 to 25 years old. This comes into really important effect when it comes to scoliosis. So obviously you have many causes for scoliosis, idiopathic or a congenital issue that you've had. It can come from embryology, so whether you're born with it or it's developed or created. The the important thing is to understand that um, with the ELDOA, and the real difference is that because you're able to target a specific area, it's not a general, I just work with the spine and the posture, is that you work individually with each part of the spine. And why that's such an advantage compared to doing a traction device, for instance, I'll use that. So for traction, even hanging, from a bar. And we say, okay to hang from a bar. You keep your feet on the floor so that the whole weight is not on the spine, and then that way you have an actual release. But you have to understand, and there's a lesion. If there's a lesion in the spine, and there's a protective mechanism that typically comes with a lesion anytime, is that your body immediately does not want to move the area to protect the area that's been damaged. When you hang from a bar, for instance, is that you're unable to target that specific joint. Just because it has the lesion does not mean that's going to be the area that opens up. In fact, it's typically the ones that are healthy that are the ones that you're actually able to get the movement from for as far as a decompression. So that in itself is, like I said, general. When you come to an ELDOA, the ability to specifically work with a certain area of the spine is that means that, again, more intelligently, you're able to stimulate or solicit an actual stimulus for the tissue around that particular area that is damaged or scarred or having protective mechanism for the proprioception. You essentially destabilize the area. The goal is to switch off that protective mechanism so that you're able to ask again for the joint space to move. And so we always say to do the ELDOA at the end of the day or after you finished everything. It's a recovery exercise. To do it before an exercise it does not make any sense, because before an exercise or before a workout, you need to excite, you need to get the proprioception to be very active and be able to be responsive. For the ELDOA to be extremely effective is that you want to do it after you finished your exercise for the day, and then you ask for all of that tissue to override the muscle spindle of contraction, and you want to release. And when you do that, you have a very good effect in a long-term sense, because as soon as you release that tissue, even though it's destabilized, is you start to create a new normal for what the joint space should be. And so that aspect of recovery, I've never actually experienced or seen in any other practice or any kind of exercise method.
Hmm. So, you mentioned like go muscle spindle a lot, and when you decompress the spine or the joint, there's definitely other proprioceptors involved. Can you kind of talk to me about like those proprioceptors?
Yes. So, really, for the proprioception to understand, there are actually four receptors or principal receptors that give information for the limb as far as where it is in space. And one of the first ones is the mechanoreceptors, and that's around the articular, pretty much the articular capsule. So working with the mechanoreceptors, you have the tendinous receptors, the neuromuscular spindles, which is, I would say, the muscle spindles, and then also the cutaneous receptors, which is of the skin. And so when I'm talking about, especially the overriding of the muscle spindle, right? You try to encourage the Golgi tendon, which is the receptors that help to release. And so when you're, like I said, holding a posture statically, meaning an isometric contraction, you start to fatigue all of these areas. You are able to override quite often the systems of protection when you hold for a static hold compared to if it's ballistic or if you're doing a dynamic movement. So there is a requirement to be able to not only have the correct posture, but the ability to create the tension, the strength to be able to hold the posture in order to help accomplish this the stimulus for the receptors of the tissue. The fact that people are doing it themselves lessens the danger. So if you have any experience when you have somebody stretching you for you, for instance, so you might have a good result where you have an increased range of motion for a certain muscle area and a certain joint. However, if you were to ask them to hold statically in a position or a certain range of motion, you might not have the ability with the strength in that kind of range of motion. So for the ELDOA, when we talk about creating an open joint space is that it's a trained system. You have to start to re-educate the tissue that it can open to that range of motion or that it can hold that position. Posturally, that's very difficult for a lot of people, as you know, with certain body types and certain postural holds. If you have an anterior posture compared to a posterior posture, you're going to have a tendency for certain areas of the spine to be either more in a hyperlordosis or you have more of a flat spine. All of that does not matter for the ELDOA. It does not matter the actual curvature of the spine. You take the posture that is going to be the most successful at opening the space for the joint. How you help to improve the posture itself is through training, whether it's training of the lumbar, the lower abdominals, of the rectors of the spine. All of those can be, as far as strengthening and stretching, those can be done. But the joint itself is what the ELDOA is trying to target, and that ability to isolate is where you have a big progression when you see a person as to what they need, but you always have a good result with the integration of the ELDOA for their finishing.
Hmm. So if you always put it at the finish of the day, let's say, let's say if like basketball always have back-to-back games, right? Like you got so if I do that on the first day, end of the game, will that kind of like make it, will that kind of fatigue the proprioceptor, or it's gonna help them recover? Like they have probably have like let's say probably 18 hours of rest. Will that help the recovery process and within the 18 hours, or it's actually
Absolutely.
fatiguing the proprioceptor?
Oh, absolutely. It does not take much to switch off the proprioception. It does not take much to switch on as well. So you have to recognize, and I can appreciate the back-to-back and being with athletes. The recovery is really important to be efficient. And so with the ELDOA and with this myofascial stretching, particularly, is a very efficient way to be able to release or to recover the joint and the tissue. So a very the intensity that an athlete has to train, you have to imagine there has to be that same level of intensity with the recovery. And that is what the myofascial stretching and the ELDOA are extremely good at, is that you work very hard for a very short period of time to recover the tissue. And then all it takes, so to say, for instance, they play a game one day and then they do their recovery myofascial stretching ELDOA after, whatever other modalities they want to do. If they want to do cold plunge therapy, you do ELDOA first and then cold plunge because you don't want to have totally cold tissue. Um, the next day, it is just a matter of warming up, just as you would. A dynamic warm up is enough to be able to then switch on all the proprioception that you would want. I have athletes who are track athletes. They are doing multiple events a day and they have to warm up for each event and they have to cool down for each event in between. And so we utilize the myofascial stretching particularly for the in between to keep the tissue nice and warm and elastic. But then we would use then the ELDOA after all of that. So they wouldn't be doing ELDOAs in between events, for instance, they would be doing them as the finisher. I do have clients who are suffering from spinal disc herniations or disc bulges. And for somebody in that category who is currently injured, is that they can do the ELDOA as much as they would like in the day. Because to be honest, when you're in pain or if you have an impingement, for instance, like sciatica, is you want to be doing anything possible to be able to alleviate that pain or that tension. So I have different rules as far as how the ELDOA is utilized depending on what the goal is. So the goal is always the important part to understand for where to put the ELDOA in your training.
Hmm.
So yeah, it does make a difference. But like I said, the warm up is just as important as the cool down. So as long as you have your um, the nice system for the tissue to be as successful as possible, to warm it up to the level that it needs to be warmed up. to be able to have the highest performance that you can and utilize the fascial system in your performance, and then have a very efficient recovery for that myofascial system afterwards is the best, is the good routine.
Nice, nice. All right. So, um, can you kind of share like some uh picture or some poses or some movement for the ELDOA that would help like especially like athletic performance?
Yeah, so with the spine, just due to the nature of how we move and work, L5S1, so the last intervertebral disc of the spine, it is the largest and is the most often the most compressed. And so because of its shape, it's shaped like a wedge. Um, it's the posture that you take for an ELDOA changes depending on what area of the spine that you want to be able to target. So in the L5S1 posture, you're actually required to lie down onto your back and have your feet up on the wall, which is the classic that most people end up seeing online. And it's not any kind of revolutionary posture because, to be honest, as soon as you lie on your back, you take about 75% of your weight off of the disc. And so biomechanically, you're already at an advantage for decompressing that area. The particulars come from the fascial tension that you put into your stretch. So it is a stretch, but as I said, you hold. So it becomes an exercise. You work the muscles around the paravertebral muscles that are in relationship to that joint space. In the L5S1 posture, the classic is that you lie down onto your back with your feet up the wall and you have your spine nice and straight on the floor. The important element of the ELDOA is the CSSC, which is it's the ability to create tension throughout the entire spine, starting from the sclera of the eye, which is where the very important fascia called the dura mater begins, and then it ends all the way on the tailbone. And so the CSSC, the ability to create a full elongation of that fascial tissue that's in relationship to the spinal cord and the cerebral spinal fluid, the elongation is the most important part. So when you're lying there on the floor, it is very important to, one, be straight. If you are somebody who knows you have scoliosis, you have to be sure that you are not in the rotational position like your scoliosis would like you to be. You try to, as best you can, correct that into neutral. From there, the important part is to create the elongation, pulling the cranium away from the coccyx is really what you're trying to do. And you do that by looking down with the eyes, and you do diaphragmatic breathing. So all of those points has actually nothing to do with the tension you create for the arms and the legs. Point blank, the important part is what kind of tension you're able to create on the spine itself with that tension. From there, then you start to create the tension from the limbs because you have a big relationship of the posterior chain, if you want to say that, in relationship to the sacrotuberous ligament that has a relationship with the sacrum. You put them straight, the legs, and you do a strong internal rotation of the hips, and you do a big extension of the ankles. And then from there, the arms to work with the thoracolumbar fascia in relationship to the lumbar spine as well. And the LeBlanc fascia is you put the arms in extension overhead, very narrow to the ears. So you would have both arms reaching up into that external rotation of the shoulder. So the fascial tension you create for the limbs. Now, in that posture, because I say for 1 minute, the goal is the maximum amount of tension that you can create. And so people are very happy to lay on the back and be passive, right? It feels good to just lay down. But when you actually add that tension, that's where the real magic happens of being able to recover the disc. You bring more nutrition and more liquid to the disc when you have the fascia in tension. So there are a couple of adaptations, maybe not so much for athletes, but some people who have tight hamstrings, for instance, they might not be able to extend the knee fully. But for hamstring tension, you still keep the hips in the corner because you need that 90-degree angle to position the sacrum to allow the L5 to drop to the floor and open up the space of the disc. However, if somebody has sciatica, which means there's compression on the sciatic nerve, if it's coming from L5, for instance, is that you need to accommodate that. We don't try to put more compression. And sometimes at that 90-degree angle of the hip, it can increase the compression on the nerve. So we don't do that. So we adapt is the important part. So the person in front of you is always going to depend on what their goal is. Again, so in the photo that I have provided is the hips are a little bit away from the wall, and that's for an adaptation for sciatica. Now, what you would do for sciatica is you would start with hips against the wall, and then with feedback, person's awareness, they say, no, I feel symptoms of sciatica, any kind of zinginess going to the toes. You say, I want you to come away from the wall as little as you need to in order to take that symptom away. So you work with the tissue. The goal is not to hammer. The goal is to ask the body to be able to do the tension that it needs to do in order to help heal the lesion. So that posture, L5S1, is probably the most important one and the most user-friendly as far as the ELDOAs. Another one that I included is the T8, T9, the thoracic spine, the center of the thoracic spine. I think there's also a T11, T12. T11, T12, so if you're unfamiliar, the thoracic disc at level 11 and 12 is very much problematic for people with scoliosis, especially an S-curve. So you have weak points along the spine. And so when working with the scoliosis, typically you would target specifically where that person's curve and transition is for their curve. So typically there's 5 ELDOAs, depending on where for that person that curvature is. You work specifically with their curve. T11, T12 is an area that typically is a transitional area for the rotation when it comes to the thoracic spine. So I included that posture because you would do both sides. They're unilateral, so you work one side and you open, and you work the other side and you open as well. Very helpful for the scoliosis. T8, T9 I included, which is both arms up with the feet flat. That one is fantastic for runners, and I say that because, as you know, with running, you have a natural rotation that happens of the spine of the pelvic girdle and the scapular girdle, shoulder girdle, in opposition. They work opposite of each other. And around T8, T9, depending on the posture, is where that center point is of rotation. So even though you might not see or experience a herniation in that area because of the ribs, there's still a lot of compression. And you have a big, important nerve plexus, the celiac plexus, that goes through that area. And if there's a lot of compression on that, it can actually have an effect on somebody's mood, for instance. So it's a feel-good solar plexus, if you're familiar. So that's a very good exercise for recovery for a runner or most athletes. The one that I particularly like that I sent to you is the cervical ELDOA. That's the one lying on the back and doing the ELDOA specific for C6, C7. So C6, C7 naturally wants to move forward in extension of the cervical spine. So immediately you have a bit of a weak point in that level. Now, my experience with weightlifting, with certain sports like cycling or surfing, for instance, there's a lot of extension that is required of the cervical spine and internal rotation of the shoulders in that posture that they have to take. This ELDOA particularly is so good for being able to decoaptate or open up the space for that cervical area and re-establish a neutral position for not just the cervical spine, but the scapular girdle as well, which is a very important relationship if you want to be able to have a good, lasting joint space for all the upper limb. So that C6, C7 particularly I like, and especially give to weightlifters. The extension of the neck, people who do wall balls, things like that, where the head is very much tilted back and you have a lot of compressive force coming from the shoulders. So good for recovering that area. And you can do it right after you finish exercising. It takes 1 minute, and it is better, to be honest, than one massage, once a week or something like that. You create a very good relationship of the tissue that surrounds that joint and the recovery. I also included 2 photos to show the difference between the myofascial stretching and the ELDOA, because there is a big difference. It might not look like it from the outside. However, in practice, and especially if you work with a practitioner, is that with good instruction, you can see very much the goal of the positions is very different. In the stretch where you have in the kneeling night position, you lean forward onto the front knee and you have the one arm in extension. There are very different variations of this depending on the person, okay, strength and flexibility. But for myofascial stretching, the real goal is to take the action of a muscle and reverse it. And everyone knows the iliopsoas as being a flexor of the hip, which is a very dumbed down way for a very important muscle in the entire body. So you have very big relationship of the iliopsoas muscles with the lumbar spine, the pelvis, and the hip. Quite often when you have a disconnect or a bad relationship of the iliopsoas muscle, a lot of people talk about strength or whatever it is, or flexibility. They say it's too long or it's not strong enough. To be honest, it's the layers of the fascia that are really important in that area. You have a fascia that's called the fascia iliaca that surrounds the tissue, the five psoas muscles. You actually have five. It's not just one muscle. You need to make sure that that fascia is in a good way. We do an exercise that's called the detorsion fascia iliaca. It's a very big mouthful again, but the goal is to make sure that the tissue of the iliopsoas is on the rails. And quite often for athletes, especially somebody who's a unilateral athlete, for instance, so somebody who often, like a soccer player, has very different roles on one side of the body compared to the other. And so often you get what's called torsion on the fascia iliaca. And you'll have somebody who wants to stretch. They want to stretch the hip flexor because it's tight, or they feel that it's too tight. But if you don't correct the torsion that's on that tissue, if you stretch the muscle, you actually will reinforce the torsion that's on that tissue. And because that tissue has a big relationship with everything in the body, intestines, reproductive organs, the diaphragm, pretty much everything in link with the fascia iliaca, you need to first prepare the tissue. And then the myofascial stretch needs to target the area that needs to be targeted. Because the iliopsoas attaches to not just the vertebra of the spine, L1 through L5, some T12, it also attaches to the discs. And so because those fibers actually attach to the discs themselves, is you want to make sure that you work with the spine when you stretch the iliopsoas as well. Many people forget that the spine is needing to actually have a certain posture to help actually put tension into the whole tissue, not just the part that crosses the hip, like the iliacus. So that posture that you see is specific for stretching not just the part that it crosses the hip for the hip flexion, but it also works with the lordosis of the spine, which is a big factor for how the psoas is able to function. So we work with that too. In the ELDOA for the hip, which you would do these together typically, especially for athletes, hockey players, I found the hip ELDOA extremely helpful. Basketball players as well, because you have a lot of impact that starts to happen for the hip. And also the posture of the foot when you have a hockey player, for instance, with the external rotation. The hip ELDOA is designed to open the coxofemoral joint. You help to decoaptate that very important joint to save the labrum, right? Because that's where you get a lot of the issues, is the labral tears and things along those lines. So the hip itself is designed to coaptate. It's designed to hold itself very tight, which is good for stability. But unfortunately, if you have a lot of stress or strain in that area, you also then have compression, you have tears, you have osteophytes that can start to build. You start to get little bone spurs and things like that that start to form, the beginnings of osteoarthrosis. And so when you do stretching, it's very helpful for the muscle around that area. But again, we want to work with the capsule, the joint space. And so the ELDOA itself is putting the hip in the posture that allows you to actually work with the ligaments in relationship to the joint space in the capsule to decoaptate. We talk about you pull it away and you try to hold and maintain it there again to re-educate how to hold space in a joint. So I found, like I said, from the outside looking at those pictures, you go, oh, okay, they look very similar. But you have to realize in the practice, there's a very big difference in how you actually feel and how you actually do those positions. So those ones in particular, the order, typically, you do myofascial stretching first. You prepare the tissue. So often you do all your stretching around the hip first. And then you would finish with the ELDOA for the hip to be able to correct the capsule, correct the joint space.
Nice, nice. I love it. This is awesome. So, uh, um,
Now, your role, can I ask you a
yeah,
question?
yeah, yeah.
Your role as a strength conditioning coach,
Yep, yep,
am I
yep.
correct? Yes. Um, what do you find in your athletes? What do you find that is the most um, attractive for your athlete to do in recovery? What is it typically that you encourage or that they tend to do to recover from their game or from their practices? What typically do they do?
Well, usually like they like to do soft tissue. They like to do stretches. And what I like, not to say like focus on the pain side is bad or something, but that's just not how I approach things. Especially like especially in learning from like guys like Dan Pfaff or guys like Gary Gray. I just feel like sometimes if there's like uh let's say SI joint pain,
Hmm.
right? There's a reason that SI joint's dysfunction, or there's a reason why that SI joint had torsion, right? You can't just do SI joint like and finish it, right? Or low back pain. There's a reason that the guy have low back pain. But usually like guys don't really understand the science behind that, so they like to do soft tissue everywhere or just stretches everywhere. So me personally, I like to besides stretches, I'll do ELDOA, the basic one, the basic ELDOA. Then I'll do like joint mob. That's typically it.
Hmm.
Yeah.
Yeah, it was interesting the transition that I had from being just a strength conditioning coach, and that's not to say that you do have to look at obviously the performance level, like what is happening in their performance, and then being able to guide them into a good recovery program. And where obviously there is some downfall of doing ELDOA myofascial stretching is that it is hard. It is difficult. It's a challenging recovery, and to be able to do it very well is sometimes a hurdle that people find. Athletes not usually so much because quite often they can feel the benefit after doing even just one session of specific myofascial stretching in ELDOA. So once they get over that hurdle of it's effort, and even if you do 30 minutes of, for instance, specific myofascial stretching in ELDOA, for the ratio that I understand is 1 to 1. So if you want to be able to maintain the balance of a joint being able to work properly, is you have 1 to 1 relationship of exercise or performance, compression. You also need that same amount of time dedicated towards the recovery of that area to be able to avoid an imbalance or a compensation. Now, like you talked about with the sacroiliac joint, so obviously quite often sacroiliac joint pain, like you said, it's coming from a dysfunction somewhere. It's not usually the SI joint that is the problem. It's coming from the pelvis being in torsion or the foot, for instance, being in a bad position, and that's all it takes for the chain to get thrown out of whack. Um, what I really like with ELDOA and the work that Guy developed is that you have a very specific exercise that you can assign to somebody. So for somebody who has a lesion at the sacroiliac joint for the base of the greater arm, for instance, very common. And so you're able to give them an exercise. And yes, it's hard during the time, but it's 2 minutes of their life that they're able to put directly into that one area that will have a good result. So not to not to blanket it, but as an athlete, I was always flexible. I didn't have a problem with flexibility. I could stretch. I had no problems in hamstring flexibility, but where I really lacked was the balance of my structure. So the my pelvis was in torsion. I had issues of the lumbar spine being and in too much extension. So the fact that these exercises were not relying on what feels good as far as the stretching, but actually the intensity and the efficiency. I say efficiency very often because you could get a big result in just a 30-minute session doing ELDOA that you might have to spend an hour with a chiropractor just to be able to get the spine to be as in a good way as what you can do with the ELDOA. You know, when you're an athlete, you're tired. You know, you put all your energy into the sport, and so the recovery quite often gets to the wayside, or it becomes a passive recovery. And I guess that's my encouragement for people who are curious about ELDOA or curious about myofascial stretching, is that it might not be passive, might not feel good in the sense of how the relief that it senses in the stress, but it's the after effect that you get that is a bigger impact. The stress that you take off your system is much bigger when you do it yourself in the active recovery. So when you're in pain, pain is the bigger motivator. Quite often, if somebody is in pain, they're very motivated to do their ELDOAs, and they are very regimented, and they do it, and then they're out of pain, they feel much better. And then they go into maintenance mode, which is just where you're able to practice on a normal basis and be able to keep yourself in a good way. Athletes don't have that luxury sometimes. You know, for an athlete, you're constantly hammering on your body, and you really do need to be actively recovering it for like you said, the connective tissue, the perception, the information that you start to give your body back to keep yourself from going into those compensation states. Yeah. Anyway, it's if you're new to ELDOA, which I know you just started to kind of learn a little bit about it and are just starting to introduce. It's really a little learning curve at the beginning. It is quite a lot to learn when you first start, but at the same time, they're very powerful. And so as soon as you start to learn and understand the concept and what you're trying to do, this is why you see people, like you said, along the lines of Dan Pfaff, and you have a lot of coaches that start to integrate it in. Olympic athletes are integrating it into their recovery, and you have, not to name names, but you have many professional athletes that have tucked it away in their little back pocket and don't want to let anybody else know about it, because it really is, as far as that performance edge, if you can get your recovery really nailed down and you can train that much harder the next day because you don't have those niggles and those pains, that's where the athlete really does, like I said, feel the difference. It's a big difference when you actually feel better the next day and you can come back and play just as hard, if not harder, because you're not having to nurse your body from not having a very good recovery. So yeah, athletic performance, I have found in my experience, always improves with the integration of doing the myofascial stretching and ELDOA routine.
Nice, nice, nice. All right. Last thing before I let you go. For those who are interested in what we're talking about today, especially like I feel like people are more interested into like spinal engine theory. People are more interested in like SI joint pain, uh, scoliosis. Where can they find your website? And like I know you also have a membership. Where can they find that?
So I used to be an absolute firm believer that you could not practice ELDOA without a person in the room with you. Absolutely. If you'd asked me 5 years ago or before COVID if you could do it, and I would say absolutely not, you cannot do it. But then COVID happened, and then all of a sudden everyone was stuck at home. And so I was as well. And I thought, if I could just reach out and just give it a go. I had clients that were still in Los Angeles. I'm here now in New Zealand. And I started working with them online, and I would watch, and I could use my voice, and that was good cueing to be able to help the person get into a good posture. It's very hard to replace being in a room with somebody, especially when it comes to palpation and being able to help them feel and get into a good position. So I don't say that my method right now is the best. However, I also realize that people are seeking help. They want to have a same thing. They want to be able to help themselves be able to feel better. And these ELDOAs are such powerful tools that I thought there's only so many practitioners in the world. You can't help as many people. Whereas if I were to do a good job and try to really utilize the one tool that I have, which is, or two, I should say, vision and verbal, if I could use those two cueing systems and be able to do a very good job, people are going to benefit. And if they're quite often in a different part of the world where there's absolutely no practitioner that is available for them to be able to see and practice with, they're better to have the opportunity to work with somebody who is as practiced as I am, has a good understanding of the postures and how to adapt. So I created this online platform to be able to provide clients with specific videos that they can follow along with, as well as the ability to follow along with classes. So the combination of different exercise modalities to be able to practice with a bit more confidence. And so after practicing online now for I think it's been what are we at now? 6 years? We're getting into 6 years of doing it online.
Yeah.
I am getting continually more and more people signing up for my website. And even though the world has opened up and they can go and travel and do whatever they want to do, the ability to do the practice at home, especially when it's, needed right away, you can have access to it all the time or whenever you want to pull up a video and follow along with it. I've had such amazing feedback from people, so thankful for being able to have that available to practice to. So my website, eldoamethod.com, is a resource for people to be able to, like I said, you can sign up for a membership and be able to get a specific program designed for you. So if you have an injury, then I can work personally with you and be able to help design a program. Or if you're just wanting general wellness and you want to be able to have good spinal health, there's a whole big library of classes and lots of different areas, hip health, spinal health, cervical, shoulder, the whole bit. There's a big library of classes that I provided and continue to grow as I'm practicing with people online. So the resource is there, and I think that it's helpful not just for the athlete, but it's also helpful for most people who are looking for that kind of specific help for their spine.
Nice, nice. I love it. I love it.
How did you actually hear about ELDOA? Was it through Dan Pfaff? Was it through the other strength coaches, or how did you actually come across it?
Give me a sec.